Well, welcome everyone to Inside Access. I'm Shauna Adamick, Executive Director of the Oracle Health Foundation, and it's an honor to be your host. Today, we continue our journey exploring how we enhance the healthcare ecosystem through partnerships, innovation, and by working hand in hand with our customers. Since launching this series, our aim has been clear: to openly share the current status of product updates and future plans that align with our goal to improve healthcare and health outcomes globally. We've tackled vital topics, from improving clinical and operational efficiency to addressing healthcare's rising cost and adapting to changing consumer needs. We've also spotlighted our innovations and shared insights from industry peers on overcoming these challenges. At Oracle Health, innovation drives us, and we know the importance of addressing today's needs. And because of that, based on your feedback, we're focused on making immediate improvements. And today, I'm excited to announce our new customer community site, a space for us to collaborate more closely and discuss your needs and challenges. So join the conversation by visiting the site via the URL shown on your screen. We look forward to engaging with you there. Over the past few months, the large healthcare conferences helped underscore the urgency of this session's theme: cybersecurity in healthcare. As digital threats grow, protecting healthcare information is absolutely critical. There are many challenges, from ransomware attacks to the need for secure data handling, impacting patient privacy and care. Healthcare is a prime target for cyber attacks due to the high value of healthcare data. Without data technology that is prevalent in the sector, these threats are escalating. The American Hospital Association reports that in 2023, over 100 million people were affected by healthcare data breaches, and 94% of US hospitals were financially impacted by the Change Healthcare cyber attack earlier this year. In 2022, data from over a third of Australia's population was stolen after Medibank, one of Australia's largest private sector health insurers, suffered a ransomware attack. Today's discussion covers cybersecurity, including mitigation strategies, how our products prioritize security, and our recently announced Autonomous Shield initiative that simplifies Oracle Health EHR migrations to Oracle Cloud infrastructure with a clear, proven methodology and built-in security practices. As we go through the webcast, please engage with us and participate in this discussion through the Zoom Q&A. So let's jump right into this important discussion. I'm pleased to introduce Dr. Michelle Flemings, Oracle Health Industry Executive Director, alongside Russ Franzel, President and CEO of CHIME, and Scott McLean, CIO of MedStar, to lead us in this important conversation. Over to you, Dr. Flemings.
Thank you for the setup, Shauna. Happy to be here today with Russ and Scott as part of the Inside Access webcast to talk about a topic of critical importance: cybersecurity. Like all of you joining the broadcast today, this is a challenge that we live and breathe every single day. But I still have a lot of questions, and I want to get through them, so let's go ahead and jump right in. Scott, it's great to see you again. Please tell the audience a little bit about MedStar and your CIO role.
Thanks, Dr. Flemings. It's great to be with you and Russ as well. I'm Scott McLean, Senior Vice President and Chief Information Officer at MedStar Health. We are a regional integrated delivery system in the Baltimore, Washington, D.C. region. About $8 billion in revenue, 10 hospitals. We see 6 million ambulatory visits per year, so it's a big operation. We have 30,000 associates, 8,500 nurses, and about 4,000 physicians. We're affiliated with Georgetown University Medical School. We're the teaching affiliate there. And we also have a Medicaid insurer in both Maryland and DC. So I'm looking forward to, cybersecurity is obviously very important to us. I'm looking forward to having the conversation with you and Russ today.
As am I. Thank you so much, Scott. And Russ, it's great to meet you in person finally. For those unfamiliar with the organization, would you please share a little bit about CHIME?
Yeah, CHIME, or the College of Healthcare Information Management Executives, has been around for 32 years, and we are a professional nonprofit association. We focus on digital health leadership, great members like Scott, who you just heard from, but we have over 5,000 executive members around the world. We're actually in 58 countries. We have 12 chapters out in the world, as well as we try to focus on some real core principles in helping those executives and able to do their jobs. And we focus on professional development, their education, their professional certification, but we also do a lot of other things in bringing them together in formal events and networking. While at least for the US market, we spend a lot of time spending time in Washington focusing on public policy and trying to get cybersecurity, as an example, really focused at a national level. And so we enjoy spending time with our great members, and I've been a personal member for 27 years. So love to serve this industry.
Thank you, Russ, and thank you for your dedication at such a broad level. And as the leader of CHIME, an association with literally thousands of members, I dare say you have a broad view of the challenges that are facing healthcare. So from your perspective, how have you seen cybersecurity threats evolve in the industry?
Well, I'd love to give a rosy picture, but this is one with a pretty dark cloud over it. And I would actually say over the years, the threat vector, the amount of and the amplitude of attacks and work that's having to be required in cybersecurity continues to grow at even beyond an exponential pace. Matter of fact, I would say it's daunting for our industry. It's distracting us from our core mission of patient care and really focusing on the community, but yet one we have to focus on now. If you think about what is occurring now in our overall healthcare ecosystem, we are a little bit of a victim of our own success. Great organizations like Scott at MedStar have done an amazing job of connecting all the information, not just within their health system, but outside their health system as well, connecting the entire greater ecosystem they have to serve. Well, what comes with that is now we have a completely connected health system, which means Scott and our members have to think about the entire security of the entire ecosystem they serve, not just their traditional, and I'll use the analogy, their old job was to protect the castle and make sure nobody got in over the moat or over the bridge or over the walls. Now they have to worry about the entire kingdom, and they have to worry about everything out there, even stuff they don't have any control over, including stuff even in the cloud, which they have no direct control over anymore. I think we can all just rest on, and again, not a knock on them at all. This is what we've seen recently with the Change Healthcare incident that has occurred. I think it's really a time for our cybersecurity professionals and our digital health leaders like Scott to step up and continue to step up, but this is a pretty daunting task for them.
Indeed, I totally agree, Russ. And Scott, in contrast to that broader industry perspective, I'm curious to hear about the impact of security threats and cyber attacks at the enterprise organization level from your unique vantage point as a CIO.
Sure. Well, I think even the quote industry of threat actors is moving fast. We're starting to see things like ransomware as a service and phishing as a service. So the speed at which they're acting means that we have to respond more quickly, because they're all over vulnerabilities and threat intelligence that's out there. Incident response, we have to, when we learned about the Change Healthcare incident, we went right into incident response mode and took a look at what we had documented. Documentation is very important to know what's in our environment and take action on suspicious activity. Security awareness, early and often, this is something we do a lot of education with our associates about, and make sure that our board and our executive leaders know about the threats that are out there. And we really have to relate to what the work that people are doing. What do they have to be good stewards of in terms of identity management and the types of information that they're dealing with, and protect it. And this specific focus on identity management is so crucial for all the actors that are participating in the system, as Russ talked about, both internal folks that we have that we employ, as well as the many people that participate in delivering care and paying for it, and what we have to do administratively.
Thank you, Scott. And as a provider and end user myself of a lot of these organizational systems and technology solutions, I'm curious, how do you drive adoption of cybersecurity guidelines and those best practice recommendations with your staff and your workforce across your organization at MedStar?
Well, I think a couple things to comment there, Dr. Flemings. One is, like most organizations, we have a process called demand management, where whenever we want to bring in a new technology, whether it's a software component or an Internet of Medical Things type of intervention, we review that for architectural fit to make sure that we can support it in our technology environment. And then also we do a security review of that, so that we want to make sure, again, that we know what's in the environment, whether it's protected with our standards, and including HIPAA business associate agreements, and we have a data security exhibit for all these technologies. So it's really important to keep clean hygiene with those things and make sure we know what they are, so when we do have an incident, we can respond to it effectively. So that's overall for the organization. And then for the 30,000 associates that I mentioned, we have regular mandatory training. I think this is true for most organizations where there's a cybersecurity component and how our associates should deal with their log-on information, passwords, how they should deal with various types of data classifications, depending on the role that they have. And then again, we seek to be a high reliability organization. And so before most of our meetings, we have something called a safety moment, and it's a short presentation that someone makes, and often we'll have a security story, and we provide these for the organization so that people can share them broadly. So whether it's in a clinical huddle in the morning or an administrative meeting, in our large leadership meetings, we're often able to tell these security stories and remind people about what actions to take or not take that helps us along the way. But it really, Russ mentioned that cybersecurity is every minute of every day, and it's something that we cannot emphasize enough with our population.
Scott, I love the idea of the security moment. I think that's definitely something that a lot of us will adopt after hearing what you just said. So Russ, got a question for you. We just heard Scott talk about how he and his team prepare for and mitigate against these types of attacks. How does that align with where you see the most significant vulnerabilities within healthcare?
Yeah, we run a survey every year called the Digital Health Most Wired Survey, and we were in almost 60,000 entities worldwide. And a big section of that is on cybersecurity. And the good news is, and I'll arbitrarily pick over the last 5 years, we've seen vast improvements in the cyber hygiene and cyber implementation in healthcare at a macro level. And so I think that's the good news. I think what we are seeing, though, is that the bad guys, the bad people out there in the world are maturing just as fast as our organizations continue to implement. So it constantly has them on the defensive. What I will say is we used to talk about the tech divide for small rural communities, small and rural facilities, even disadvantaged communities within large urban areas. We're seeing the exact same thing occur in the cyber front. And I think that's the greatest threat. When you talk about a connected ecosystem, you're only as strong as your weakest link. Scott's greatest vulnerability might be the single physician office who connects to a system, who has their person who runs the front desk is also their IT person. And so when you think about small, rural, disadvantaged communities that just don't have the resources, both human capital as well as financial resources, that creates a big vulnerability to the macro level industry. I think the part, though, that counters that vulnerability is collaboration. I don't think any of us in this industry think that we have a strategic advantage because we're a little stronger than the person next to us from a cyber perspective, which means we all are willing to share, we're willing to collaborate and think of things differently. And not always do we believe that the government's there to help us every single time. Sometimes they're there to punish us a little bit. In this case, I think cyber is an area where they're really trying to help. You have great offices like NIST and CISA and Baldrige and ONC who are really trying to help us to not only identify those vulnerabilities, but find ways to collaborate and mitigate those. And I think it's a good time for us to be working on this in a very collaborative way.
I think that's a great call to action, Russ. Are there any additional opportunities or insights you think we also should consider?
Well, I think there's quite a few, and that is that we are at this point in a very vulnerable state in our industry. What we are seeing is, as I mentioned before, and Scott has led this initiative for us for many years in our public policy perspective, Washington is at the forefront of this. I think this was a bit off the radar as other things took precedent, obviously importantly as COVID and things of that nature, economics. Now cyber is reaching to the tip of the spear, and I think we're starting to see this work across the board. Being educated on what is occurring in Washington, what the threat vectors are, what we're trying to mitigate and collaborate as a universal whole. Even what is a security incident is something now they're trying to federally legislate, because an incident in Scott's organization may be completely different down the another organization right down the street, the way we define it today. So creating standards and opportunities, but having great people like Scott and the rest of our policy steering committee on a day-to-day basis, working with our Washington leaders to try to get our arms around this as a collaborative whole for our nation is probably one of the most critical things I think we should be working on at this point.
Thank you for that, Russ. And thank you for your work in that area, Scott. That is just so important. And thank you both. This has been very informative. But before I let you go, I have one more question. And Scott, I'm going to start with you. Russ, I'll say, though, that I'm also curious to hear what you may have to add in this area as well. But Scott, as a CIO who lives this and breathes this every single day, what is your recommendation on what others across the industry should be doing to help defend against or mitigate this risk of cyber threats?
I think it's important to be aware of threat intelligence, and there are some very good sources. Russ mentioned the Cybersecurity and Infrastructure Security Agency, CISA, who has regular bulletins and meetings about threats. The American Hospital Association has hired a former FBI agent who's running cybersecurity awareness for AHA, and I'm on a monthly call with them and other CIOs and CISOs from across the country. They also invite FBI agents regularly to inform us and keep us aware of what's happening. We talked about security awareness in our organizations, and I think the more that we collaborate about this and make sure that we educate people what they can practically do to defend themselves in the particular role that they do. So it requires a customization of communication around these things, which is work, and I think well worth it. And then defense in depth, and Russ mentioned NIST. There are many frameworks out there. We follow a NIST framework, and you think about technical controls like firewalls and antivirus, physical controls like locks on data centers and data closets, administrative controls like policies, and then behavioral controls like phishing tests. And so we try to practice all of those things regularly and keep up with keeping those things updated in all of those categories that I mentioned. And so I think people are doing this, communicating about this. I mean, it's important to protect our data, to classify it, and again, of course, to have air-gapped backups on all of the data.
Thank you, Scott. And Russ, are you hearing anything about other critical areas from your membership that our listeners could or should explore at their organizations?
Yeah, I do think there's three really common threads that we see in successful organizations. The data bears that out with our survey, but it also bears it out with what we see occurring in the industry. One being a living, breathing risk assessment. I think organizations that focus on a true risk assessment from a cyber perspective, and that is not just a once a year, then stick it in your drawer. This is a living, breathing document, because at any moment, something could change. The threat vectors could change, the actors could change, your organization could change, and those things have to be occurring. Other mature organizations, I think, are doing things at a board level. Great digital health leaders like Scott and his CISO are responsible for, yes, guiding, educating, and actually developing the cyber plans. But cyber now has to be owned at a board risk level. This is one of the greatest organizational risks that have ever occurred for a health institution, or actually any company in the world now. And so understanding that risk management plan at an organizational level is quite important, to include the education and skills development of all staff. I said this the other day to somebody, and I said, for the first time ever, including you, Dr. Flemings, every single person is a digital health worker moving forward. Doesn't matter what your job is in a health system, you are a digital health worker, which means you have cyber skills and cyber responsibilities. Even if you're responsible for housekeeping, guess what? They use an iPad to get their room assignments. They have vulnerabilities. So it's one of those. And I think finally, let's just come to the stark reality. Everybody is either been hacked, is being hacked, or probably will be hacked, which means incident response plans have to be amazing, not bulletproof, but have to be living, breathing practice documents so people are ready to react. I don't think there's an organization out there at this point that doesn't believe they have a real vulnerability somewhere that they don't need to be ready for. And so I think those three things, if organizations really focus on those three things, they will not be bulletproof, but they will be more prepared than probably others out in the industry.
Scott and Russ, thank you both. This is amazing. Some very strong and great recommendations. And yes, it's absolutely true. I am a steward of the data. I want to thank you both. This was just great. You both spend a lot of time with us, giving your insights and your expertise, and I always appreciate the opportunity to catch up with leaders like yourselves from the industry. I hope that this was as beneficial to you and the audience as it has been for me. And with that, I'll hand it back over to you, Shauna.
Well, thank you very much, Dr. Flemings, Russ, and Scott, for that conversation. This plays such a significant role in healthcare. We must keep patient and business data safe from cyber attacks. Thank you for your insights on how to become more resilient to these cyber threats. Next, let's hear from two of our Oracle leaders. Many of you heard last month that we launched our Autonomous Shield initiative to simplify and accelerate Oracle Health EHR migrations to OCI at no additional cost. But what does that mean? And what is Oracle doing to help not just our healthcare customers, but customers across several industries? For this conversation, I'm going to hand it off to Mike Sicilia, Executive Vice President for Oracle's Industries. Now to you, Mike.
Thank you for leading that conversation, and to Russ and to Scott for your healthcare industry peer view on cybersecurity. As you may be aware, we run many vertical industries at Oracle, not simply healthcare, but lots of different vertical industries: telecommunications, financial services, retail, and so on. And as such, we are seeing cyber issues really firsthand, and cyber challenges across all these vertical industries. And I think we can offer a perspective across industries that it could be, I think, very useful in healthcare. So to help me discuss that, I'm more than happy to introduce Oracle's Chief Information Security Officer for Health, Steve Fridakis. Steve, welcome. Thanks for being here.
Thank you for inviting me. I'm totally honored to be here.
Thank you very much. And just as a reminder, before we get started in the conversation with Steve, which I think you'll find very insightful, feel free to use the Zoom Q&A along the way. If you've got questions or feedback or comments, please go ahead and use that function as we go forward. So we've all heard a lot, and we just had another conversation, just before this, about the challenges plaguing the industry, and the reasons for some of those challenges, whether it's dated infrastructure, whether it's internet-facing portals, or quite simply the fact that healthcare data is very valuable, and therefore it's unfortunately a big prize for bad actors. And in the midst of all that, there are ongoing debates around AI, the usefulness of AI, and all these kind of things in healthcare. So there's certainly a lot going on, a lot coming to a head, and lots of decisions that have to be made, I think, in pretty short order, to really think about how do we secure our borders, what's the role that AI plays in that, and how do we protect this critical asset. So Steve, you just started the conversation that we all did with Russ, Scott, and Dr. Flemings, and the cybersecurity challenges that they see facing healthcare. From your point of view, what are you seeing? You're dealing with some of the biggest healthcare organizations in the world, our customers. What are some of the biggest challenges that you're seeing those organizations face in terms of cybersecurity?
The biggest technical and cybersecurity challenges healthcare organizations face are not technical at all. We have legacy systems to integrate. We have a shortage of professionals that we're trying to hire. But these are symptoms of what I believe is a deeper problem, and that is lack of cyber consciousness within the healthcare industry itself. Now here's what's going on. We place our focus on care over security. Healthcare industry provides patient care above all else. So that leads to a culture where cybersecurity measures are seen as burdensome obstacles rather than essential safeguards. We give emphasis to usability and patient well-being, especially in time-sensitive emergencies. I have been a volunteer EMT for many years, and I have witnessed passwords on emergency room devices. I have seen people struggling to get information, sharing over a counter, what I would consider quite sensitive stuff. Now, this is something that is tolerated in the industry, and we need to, again, think about it as something that we deal with every day. Patient data is scattered across disparate systems, making it quite difficult to track, to secure, to manage. Many healthcare organizations look at outdated medical devices, and those need to be integrated now with systems such as ours that operate in the cloud, and they are quite complex to do so. So the opportunity is that upgrading these systems can be costly and disruptive, but the risk of a breach due to vulnerabilities is quite high. The healthcare industry is constantly bombarded with new regulations and compliance requirements that are so difficult to understand And frankly, their mandates for very few days of notification and something else is quite overwhelming for understaffed IT security teams. So this is how I draw the environment that we are asked to operate in.
Well, thank you for that insight, Steve. I mean, obviously, lots of fascinating points there. And let me share some stats from other industries. As I mentioned, at Oracle, we're operating in many vertical industries, and then come back to why these global stats are so acute and such a big problem in healthcare. But according to IDC, 33% of organizations worldwide have experienced a ransomware attack. That's 33%. And they're the ones that we know about. Obviously, so much more out there that are latent or so-called Trojan horse attacks where organizations are infiltrated and unfortunately might not even know it. 82% of all data breaches involve the human element. Now, you just gave a perfect example of that, Steve, with the password on a sticky note as you were an EMT and seeing a password somewhere stuck on a monitor. And, that's, again, a human elements issue that unfortunately is really low-hanging fruit here. Or in some cases, we see breaches that involve no passwords at all, where somebody forgot the password protect something. There's a lot of very old technology in healthcare. Passwords weren't always required. They were optional. And people may be running these servers for years and years and years and forgetting that they didn't password protect them. These are really easy pickings for bad actors. And then 92% of organizations that we at Oracle surveyed said they have a cloud readiness gap that places them at risk. Now, there's some wide-reaching, stats across all vertical industries. Let's come back to health for a second and why these vulnerabilities are so acute. There's a really interesting fact. On the dark web, bad actors can sell personal health information for 50 times more than they can sell credit card information. So credit card information is really no longer as valuable to bad actors because of the fraud detection and all the reasons that credit card companies can shut these things down very, very quickly when they suspect they've been stolen. Personal health information may take us a while to figure out that your health information has been stolen, and obviously there could be some very compromising information. So 50 times, put that in perspective, 50 times more valuable to bad actors than credit card data is health information. And this one really gets me. 1/3 of Americans were victims of a health data breach in the last year. That's the part that gets me. In the last year, 100 million Americans were victims of a health data breach. Most probably don't even know it. We all see the Change Healthcare cyber attack in the news, which has been in the news for many, many months. Unfortunately, still lingering effects from that. And, many are calling this the most serious cyber attack in healthcare history. So, Steve, with all that in mind, all that lovely news in mind, can you explain how we are helping healthcare organizations navigate through this mess of cyber attacks with our technology?
I do believe that the beginning is our people. We employ a large team of globally placed security specialists that continuously monitor our infrastructure for threats and vulnerabilities. We have a vast amount of resources that we utilize, including security tools, threat intelligence that we generate or we acquire, that many smaller healthcare organizations would not have the ability to acquire as easily. We enforce very strict security protocols on how we share information, how do we segregate the information among our various customers, and how we communicate any suspected or confirmed incidents. Our cloud-based deployments leverage what we refer to as continuous improvement and development pipelines that automate application builds, testing, and deployment. And some of them are actually quite sophisticated and operating in a very in classified settings. We have a global reach with a vast network of data centers across the world. Now, all of these allow us to detect and respond security threats that are fast, complicated, and we can do this in a much more effective way than most healthcare organizations will be able to do on their own. So synergy with us makes sense. Now, recently, as you know, we have also launched an initiative called Autonomous Shield And that is an initiative that allows customers to determine whether the cloud and in what ways the OCI capability of our applications would benefit them. So obviously, migration to the cloud is complicated, and it is something that is complex, not just because of the integration of technologies, like I said before, the legacy systems that a healthcare organization has, but also from a perspective of internal controls, interfaces, vendors, and so on. So this initiative helps our customers determine the readiness for transferring and utilizing OCI cloud applications. It helps them understand their current security-based strategies. It helps them understand the migration path and architecture. It helps them understand how they will utilize all our native OCI security capabilities for their benefit. So not only this is something that has tangible returns, and it is something that will allow them to determine their path to the cloud, but it's also offered for free for anyone who is contemplating migration to OCI-based applications.
Well, that's really terrific. Terrific news. Thanks for sharing that, Steve. And you touched on some of the cross-industry things we're doing, with saying that for things we're doing for governments, even in classified settings and so forth. How is that really helping us in healthcare, and how can we take all of those things that we're seeing in consumer-facing industries, government settings, and things like that, and really help put better security around our healthcare assets?
So Oracle Healthcare learns from other industries. Understandably, some of those industries, such as the financial industry, has more extensive experience dealing with sensitive financial data. So looking at how they defend against social engineering or other attacks is quite useful to us. By collaborating with other sectors within Oracle, we can get valuable insights and very practical indicators of potential compromise that we can utilize. Now, when I was thinking of this question, I started trying to understand whether this has actually happened for real. So in 2007, you may recall retail giant TJX, 40 million customer records were compromised. And what we saw, only in a few months afterwards, the same exactly customers were actually attacked, suggesting that there was a correlation from something that was a vendor to something that was immediate to a customer. And we have seen quite a few of these. Similarly, in 2017, the WannaCry attacked many healthcare organizations, including most notably UK's NHS. And then a few months later, we saw that the same exactly customers were attacked in different settings using their credit card information, personal information, and something else. In 2018, again, we see attacks by hacking group of hospitals and clinics. And we see that those records were made available in the dark web for others to use. So Oracle and we very much recognize our unique ability to analyze, obviously obtain, and share information that leverages our cross-industry expertise and threat intelligence. Our healthcare customers can build a much more secure future for patient data, taking advantage of this industry share capability that Oracle is trying to foster. At the same time, this, coupled with investing in cybersecurity awareness training and allocating resources for continuous monitoring, will help us not only recognize the future of a much more secure healthcare setting, but to make the transition to OCI-based healthcare not only a matter of upgrading of technology, but upgrading the full capabilities of our patient systems and our healthcare customers.
Yeah, thank you, Steve. You shared so many great points there from just general awareness and understanding in the healthcare space around cyber issues, around what we're doing with Autonomous Shield, around where some of the vulnerabilities are, and then frankly, what we think hopefully has a lot of value is what we can do at Oracle to help our customers be in a much better position to defend themselves against this unfortunate cachet of bad actors who don't appear to be ending their assault on the American healthcare system anytime soon. And that's very unfortunate. But we're reminding everyone, please take advantage of our Autonomous Shield program. We'd love to engage with you on cyber defenses. We'd love to engage with you on proactive discussions around cyber and helping to keep all of you safe. So Steve, thank you to you and your team for all that you do to keep our customers safe and to keep ahead of the things that are happening in the cyber world. And I thank all of you again for your participation today, your comments, your thoughts, your questions on this most important topic. In fact, it is the most important topic. Cybersecurity is job one. Without it, we can't do much to serve the world. Everything we do has to be secure. It's secure in every vertical industry that we operate in at Oracle, and healthcare is no exception. So thank you all again. And with that, Shauna, I will hand it back to you.
Well, thank you so much, Mike and Steve, for further highlighting Oracle Health's Autonomous Shield initiative, our cybersecurity focus across healthcare products, and how insights from other industries can revolutionize healthcare. If you'd like to learn more about our Autonomous Shield initiative, visit our cybersecurity page at the URL listed below, where you'll be able to gain insights into our comprehensive approach to security and compliance. Well, hosting this webcast has been an absolute pleasure. Thank you to our speakers and the entire Oracle team for your participation in another episode of Inside Access. As we conclude, please note that the Q&A section will remain open just a bit longer for any additional questions you may have, and mark your calendars for our next session on June 18th at 11 a.m. Central Time. Also, please take a moment to fill out the survey before you exit so we can continue to provide the content that you want. Thank you for taking part in this discussion today and for your work in building the future of healthcare.